Pregnancy, the most sought after phase in a married couple's life. It needs all the care, and hypertension is one of the problems which at times creates issues. I am Dr. Rajiv Dang. I am HOD Internal Medicine, Max Hospital, Gurgaon, and I'll be talking to you on some important issues related to hypertension and pregnancy. In around 10% of pregnant females, a higher blood pressure recording or hypertension is found. So whenever you go to your clinician for an antenatal checkup, a proper blood pressure assessment is a mandatory stuff for all the clinicians. So patients having blood pressure values above the acceptable range before the 20th week of pregnancy, these may be considered as chronic hypertensive patients. That means patients who are already having blood pressure, but then they are not aware of it. While blood pressure values which cross the permitted zone after the 20th week will be considered as hypertension associated with pregnancy or gestational hypertension. Few of these cases further start showing complications in the form of proteins in the urine when they will be considered as pre-eclamptic, or they go into some other complications when they may be considered as eclamptic group of patients. So our primary concern is that why do we want to attend to this topic of hypertension in pregnancy? The reason being that this has a bearing on the outcome. It can affect the child for the simple reason that an increment in the blood pressure values means a varied and a reduced blood supply to the child, and therefore growth and development of various organs can happen. This condition is also known to cause a bleeding under the placenta, again compromising the welfare of the fetus in the womb. So the conceptions that anybody can record blood pressure and treat it is absolutely wrong. Depending upon these electronic BP apparatuses is not the right choice. Trying to take medications on your own to control blood pressure is again a very wrong way. So to say, a proper selection of drug after proper assessment of blood pressure, considering the basic status of the patient, the status of the body, the pregnancy in the first or second pregnancies before this, everything becomes important before we take a call as to what can be the best drug suited for you. So self-medication is an absolute no-no in such situation, so that the outcome and the outcome with the fetus is only positive for the family. So considering the wide range of difficult situations which the hypertensive disease may produce, it is important that a proper medical checkup is done and carried out on all females, which includes some blood tests, which include some cardiac performances, which include a good ultrasound, which include a good eye checkup, which include a good sugar assessment, and some related things, which of course can be carried out only under expert guidance of a gynecologist. So since the disease has a very wide spectrum of presentation and the effects and side effects which it might have on the pregnancy and the fetus, I request and suggest everyone that don't try to treat it on your own. It requires a set of basic investigations and some specialized workup under the guidance of a gynecologist, may be coupled with a physician or a cardiologist. We don't want any complication to occur, and the list of complications includes fits or eclampsia or cardiac involvement or kidney involvement or lungs involvement. So this is to be taken care of in the rightest possible way. Don't try to treat it with drugs on your own. There are drugs which have widespread side effects on the baby. So to say, there are very few drugs which we use, so very selectively we use few drugs for treatment of blood pressure. The home remedies, the simple home remedies we will accept, Nothing more than that. Like you say, if you take more of carbs, you take more of fried items, you take more of bread, these things can turn out to be negative. While taking more of oil, olive oil in the right proportion, lot of greens, lot of fruits, these things are reduced to lower the blood pressure and they ultimately give us a positive outcome. The dose of the drug also needs to be monitored very carefully. Therefore, a timely visit to the clinician or the gynecologist becomes the foremost requirement in those patients who have been labeled as hypertension. Many of these cases post-pregnancy, post-delivery will also require a constant care or observation because we feel few of them will go back to their normal blood pressure ranges, but few of these patients may require a long-term blood pressure medication and care. Please don't forget that these medications will have influences on the breastfeeding of the child also. So carrying on with the care with the concerned clinicians becomes a foremost thing for all of you entering into the phase of pregnancy. So to sum up, pregnancy is a lovable and a wanted experience in our life. We want that all of you should get only the best positive results out of it. So please follow the doctor, the gynecologist properly, whether be that for the overall well-being or the blood pressure related components. Self-medication is absolute no-no and recordings should be carried out by the patient only under guidance along with the suggested investigations. You are more than welcome to ask us any question in relation to this or in relation to anything in related pregnancy disorders. You can subscribe to the YouTube channel also and go through all the details.